Health disparities in rural communities. For NU716, Cultural and Health Perspectives, my name is Pamela Matthews. Health disparities in rural communities. Cultural interpretation affects patient care. Cultural competence is critical in healthcare to improve the quality of care, improves communication, and directs according to preferences and beliefs of the patient and their community. Cultural competence. Actions providing consistent care across healthcare platforms, including behaviors and attitudes to drive policy changes that will be collectively integrative in effective cross-cultural systems for caring and improving health outcomes. Culture is defined as a comprehensive spectrum of definitions focusing on shared beliefs, preferences, traditions, and consistent ways of thinking. Cultural influences for rural populations. Culture is explored by examining groups and cultural interactions between groups and their members. Rural populations view perceptions of healthcare services based on cultural perceptions. Cultural views include social factors, geography, and how legislation affects outcomes for individuals living in rural populations. Cultural competency in rural care. Rural populations that are higher risk for chronic disease. Access to healthcare remains a substantial challenge in rural communities due to lack of healthcare providers in critical areas and poor health literacy rates for rural population. Lack of healthcare literacy makes it difficult for rural population to decide critical issues related to their health. In rural communities, there is also a large emphasis on interconnected social networks that act as support systems within the community. Due to this phenomenon, individuals within these groups are more concerned with their reputation and how others see them. Ziegler and David Heisar Transcultural Assessment Model, a theoretical framework. The Geiger and David Heisar Transcultural Assessment Model, GTAM, is an effective model for assisting the advanced practicing and DPN nurse in healthcare settings to integrate cultural groups and needs and the individuals within the groups together to provide the best patient outcomes. Using the GTAM design framework, the APN DMP examines the patient's needs using cultural awareness to structure and assist the patient through a systematic process aimed at improving quality of care. These cultural dimensions are communication, space, social, organization, time, environmental control, and biological variation. This is a visual of the GTAM model. Cultural competency and the role of the APN and the DMP. The role of the APN and the DMP regarding cultural competence is to provide advanced clinical leadership in the role of nursing. There is a high demand for well-educated APNs and DMPs who will lead the way to model and demonstrate transcultural care, skills, knowledge, and congruent care. The AMP and the DMP are experts in integrating with patients from diverse backgrounds using respect, culturally sensitive communication, and actions to align the core features of culturally competent care. Culturally competent care and the role of the APN continued. The APN and the DMP using transcultural assessment model experiences a greater sense of confidence in their ability to organize, assess, and interact with diverse patient populations. Using the GTAM, 6 cultural phenomenon enables the ANP and the DMP to facilitate communication, assess patient populations, including social organizations and specific environments, to provide sensitive, individualized care. Conclusions. As healthcare providers, there's an ever-increasing global cultural competence global network. As a result, the cultural competence is vital to connect to patients and prompting the care and support with the communication styles, including eating preferences, religious practices, dietary preferences, and family dynamics. Ongoing research regarding best practices is essential for improving the quality of care to close the gaps in cultural variations. The APN and the DNP must continue to deepen their awareness and understanding of cultural variations to promote integrated theoretical frameworks for transcultural nursing care and curricula for nursing programs and healthcare organizations. Application of transcultural assessment improved culturally competent care through correct interventions and modalities that address transcultural care models for nursing and culturally congruent care for patients. Thank you.